All right, we're going to start with our next speaker of the morning. Again, one of our own, Dr. Ara Elmajian.
That's right.
Yeah, but good people.
Figuring that out there. Ara holds a Doctor of Dental Surgery from the University of Alberta, 1975, and he's studied and worked extensively in the fields of pain management, temporal mandibular joint dysfunction, orthodontics, prosthodontics, as well as head, neck, and facial pain and chronic illness. His office utilizes a multidisciplinary team approach to treat chronic pain through myofascial therapy, neural therapy, craniosacral therapy, homotoxicology, oxidative therapy, and other complementary modalities. I noticed there wasn't anything about teeth on that one. In his team, he has 2 MDs, 1 TCM, a naturopathic physician, and 2 other dentists. So I'm sure we're going to be in store for a great treat today. I'm looking forward to Ara's presentation, so let's welcome Ara.
All right.
Fix your tie.
Are we ready, Chris?
Yeah.
Can I start? Good morning.
Good morning.
Hi. I have to do the regular thank yous and etc. because it's very important to me, honoring people. This room, this place is very special for most of us because this is where I met many great people, as I'm repeating other lectures, which is true. This is, I remember when the podium was there and we had this funny German accented lecturer talked about the 4 components. That's where I met Dietrich at this first lecture in this organization. And we have very similar philosophies regarding the autonomic nervous system. So we really got together and stood in that corner for 2 days and talked about how I use my needles and how he uses his needles. Because we both, those days, used a lot of injections, and I still do use injections. So the evolution of a pain practice is basically is a slide I use all the time because that's how my practice evolved. And a few people only have been to my office, like Harvey has been coming to our office quite a bit last few years. And there he walks in now. And he always asks me, he said, how do you get away with this? What are you doing here? Honestly, it's true. But I explained to them and to him many ways how I did what I do and how I get away with it. First of all is intent. I have no intention to hurt anybody. I've been chased by the board, and after I was chased, I went even further, wilder. Okay? Why? Because my intent was I'm not going to hurt the patient. And throughout this lecture, I hope you learn from what I tell you how I deal with that component. Now, again, if you just wait and watch what the universe brings to you, things always work out in the end. Like today. Well, I had my white shirt on Friday because I was supposed to be the second lecturer. So I was excited, all ready. And I come and things change. So this institution is at a luetic stage because they change their mind, which is fine. Like Dietrich, he's in a luetic stage. He has a right to change his mind. So it turned out better because I had a chance to listen to the other lecturers and what they had to say, and especially Bruce was a great speaker. Who wants to speak after Bruce? He's such a great speaker. And another guy I admire is Slagle. He is really cool. And they set up the whole system for me. They made it easy for me. So if I was angry Friday, that wouldn't have worked out. So now I'm older and more mature. So things worked out for me. So now you had enough of all the techniques and glutathione and selenium and all that, I hope. But I have to mention some because it's very important. So I'm going to change a bit. I'm going to speak a lot about the emotional component today. How I diagnose my patients and how I detox them. And we seriously do a lot of detoxification in our office. And I also have to thank my staff over the years that really supported me. I would have never been able to accomplish what I accomplished if, let's say, David is not doing certain components that I cannot do now because I'm too busy doing something else. And the other thing I did that worked to protect myself, for 15 years, I've had a medical license practicing in my office all the time. So I'm telling him what to do. I'm protecting myself behind this license like this. And he goes, okay, and I'm doing the work, basically, right? So that was my secret. So if you're scared, have a naturopathic physician or a physician working right in your office all the time. And currently I do have an ND and an MD, TCM, who was an MD too, work in my practice. It makes it quite easy for me. All right? So that's how we evolved. In today's lecture, I'm going to speak to you about detoxification. Now, Kinetic Patterns is the name of the clinic or the company for tax reasons, but the reason it's called Kinetic Patterns, and it's funny, when you meet people that think alike and they had the same notion, the reason I call it Kinetic Patterns because that's my diagnostic method. I look at patterns. I do not trust any test, not even a blood test, because it's just a picture of this moment. So we have thermography, heart rate variability, we have ART of the moment, we have whatever of that moment. So I look at patterns, how this patient reacts on a Monday or on a Friday. And everything is kinetic, so I see how the patient is changing. Change is extremely important, and you have to recognize the changes. And the autonomic nervous system is what we have been talking about for many years, but remember, the autonomic nervous system is influenced by the limbic system. And the limbic system is the system that is run by motivation, behavior, and arousal. This is a very keynote word. The limbic system works with motivation and arousal. And the limbic system influences the autonomic nervous system big time, because the limbic system has sort of a priority. So it skews the autonomic nervous system. Also, the limbic system affects a lot the endocrine system. So limbic system, endocrine system, your arousal mechanism, your motivated behavior, the autonomic nervous system regulation. In functional or physiologic medicine, we owe most of these equipment, we are checking the autonomic nervous system, how it functions. Is it sympathetic, parasympathetic, etc. And if you get to a level of consciousness, you could drive Rifting crazy back there. I call him Rifting. Because he tests me sometimes, he says, "You're paradoxical. You're not supposed to do this." Actually, I'm using my limbic system to change his machine. And by the end of the lecture, you'll all know how I do it. All right? So the autonomic nervous system is a very important guideline, and I utilize it as a pattern how to treat my patient. And today's lecture will be detoxification and drainage. And I don't like lectures when they ask people to raise their hands, but I have to ask, how many people here, honestly, because I know you can't, really regularly detox themselves? I could tell, yeah. If you want to do this, you have to detox and drain yourself, because that makes you understand what happens to your body, what happens to your mood, and if you do any dark field microscope, when you're detoxing, you think you're having cancer, right? So when you detox and drain yourself, and you do it rhythmically according to the seasons, according to the weather changes, etc., you know how to talk to your patient. And you know how to get his limbic system aware, so you regulate his autonomic nervous system. That's a trick. If you don't do it yourself, you're just acting, you are. And patients eventually know that you're acting and they will not listen to you. Oh, could we go back once? I pressed it twice. And thank you for coming. Only eclectic practitioners like you who many years ago was scared doing functional appliances. You started removing amalgams. Only people like you attend seminars at IABDM. And now, hopefully, we're going to teach you to cover even more components in your offices. And I'll show you how I did it. I'm more known in the United States than in my town. No, they don't know me, right? When I met David Charbonneau, who's been there for 20 years in my town, he says, how come I never heard about you? That's how it goes. So, this is a very important slide. The dysregulation of the autonomic nervous system is through, there are 5 components actually: structure, function, biochemistry, electromagnetic, and the emotion I call the opposing thumb. These components are very much interrelated. And in any chronic condition, the conductor of the symphony is the emotion. And I tell these my patients, and they get it immediately. Look at your hands. I go, this is a functional component. This is a structural component. This is a biochemical component. All right? This is the electrical component. But we are different than all other animals. We have an opposing thumb. Because the emotion could change your structure, emotion could change your biochemistry, and the emotion could change all others. That does not mean that the other components do not change, but the most powerful component is the emotional component. I see many practitioners who are quite mature here. Don't you wonder sometimes, a guy with 15 root canals and all these amalgams, a guy is winning races? How does that happen? Tell me. Give me a break. All right? Anyhow, detoxification and biotransformation, reduction of the toxic properties of a poisonous substance and the chemical alteration that a substance undergoes in the body. And Bruce showed us how the phases in the homotoxicology, which, take it with a grain of salt, because in a few years, are you hearing me? That will change a little bit, but the model is the homotoxicology. Am I working?
I don't know. Yeah, that's on. Test 1, 2.
It's a connection, a loose connection, the loose connection someplace to the cord.
Yeah, working. Poison. These are all in your handouts. And poison is any substance taken into the body by ingestion, inhalation, injection, or absorption that interferes with normal physiological function. That's a poison. Homotoxicology is the effects of these toxins on humans. And there are certain types of homotoxins, the endogenic and the exogenic. And what remains in your body, we call them retoxins. In that orange manual of HEAL, which is great. The first 30 pages are amazing. So the milieu, which is terrain, this is also a very, very, very important slide. And it's milieu is what we work with in our office. Now I like analogies. Let's say the milieu now is in this hotel, and we were at that restaurant, and ordering our meals, and the waiter and the waitresses are coming and ordering your food this morning, and remember that's sort of, we're going to talk about how the body functions. You order a meal, and your eggs come cold or hot or perfect or whatever. So that's what happens eventually with the body. The milieu determines what's happening at that moment. Environment is extremely important. The matrix, according to Pischinger, we went over it yesterday, and the ground regulation is also extremely important. There are different aspects. The matrix is different how your matrix gets regulated. And the goal is to maintain homeostasis. Drainage. Many years ago, an engineer, my favorite patients are engineers because you don't have to waste time with an engineer. They understand it very, very quickly. They get them fixed, and eventually at the end of the lecture, you know why they get it very quickly. A drainage system is a complex mechanism funneling and integrating weaker and more diffuse forms of runoff into progressively deeper and more intense paths of activity. For us, naturopaths and physicians, drainage is a process of detoxifying the body by opening the emunctories and discharging the toxic accumulations. In our office, drainage has three components. We have the mechanical component, the biochemical component, and the energetic component. I should add actually another one, the patient's component. What we put the patient to work. They have to learn how they achieve drainage. And in our office, we use a multiple systems, some MRT. We send them out for colonics. We teach them hydrotherapy, lymph drainage, manipulation, physiotherapy. We send them to saunas and others. And there are some pictures, certain machinery that most of you utilize. The Vega Som, more of an energetic. MRT is very important in our office. We also do a lot of cupping, Chinese cupping, because I have a TCM that is wonderful. And it's funny how certain patients like the MRT, others swear by the cupping. So the ones that like the cupping, you give them the cupping. And it depends on their personality. And then we have the electromagnetic component. You could use a Select or this one, or you do energetic medicine. You give them the remedies, and this is like you could see the cupping. And we have many toys that we use them in our office. We use our machines. We just don't let them just collect dust. And also we utilize chelation and acupuncture, and we also utilize many homeopathic and energetic remedies. You can see some sonams there and some undas, etc. And a lot of you have these components, and we also use light and electroacupuncture, Chinese heat lamp, etc. In the meantime, and we use a lot of castor oil packs. We teach our patients how to use castor oil packs, and they're magic. Are you mostly familiar with castor oil packs? Okay. So in our office, we currently, the last 3 years, we switched. We could call our drainage based on biotherapeutic miasm theory, which Louisa understands very well. And last year, she gave us a great lecture on the Schussler salts, which is a part of biotherapeutic drainage. The difference between the biotherapeutic system and homotoxicology is they do use all the principles of homotoxicology, except in biotherapeutic drainage, we look at the patient's personality, their reactivity mode, their miasms. And in 15 to 20 minutes, I'm going to lecture on a 4-year course here on miasms. And I hope I'll do a good job, because there are a few naturopaths that know this stuff, and I hope I do a good job. Bruce went over these many phases of homotoxicology, and these are the 3 phases, and this is my picture of the divisions. I think this is better because, this is drainage. So basically, could you go back? Thank you. It's not just in the humoral stage. Sometimes you are jumping between the matrix and the humoral, the matrix stage, the intracellular stage. You're going back and forth. And what is really deciding the speed of the degeneration or regeneration is the person's miasm, their personality, how they participate in their wellness. That's what I found out after 31 years of doing this. In the humoral phase, we have increased physiological excretion, we have inflammation, things go fast, and at this stage, we could get away with just tissue salts, minerals. We could use complex homeopathics and low dilutions, gemotherapy, oligotherapy. You could just use oligos and the patient will be fine. You could use just Traumeel and lymphomyosote, they'll be fine. You could just use that. Today, we're discussing 2 types of patients. For the dentist, how you detox, and for people who do chronic illness and chronic pain. Now, there is not two patients we do drainage and detox the same. It depends on their commitment. And the commitment is 2 to 5 years. We cannot get a patient better. It takes 2 years minimum. And then, but the dental detox, we will go over it very quickly. You could use the HEAL kit, lymphomyosode, berberis, and nux vomica. It'll work out. But in the humoral phase, you just use these catalysts and minerals. It'll work. But in the matrix phase, which is a bit more involved, you use a bit more higher dilution. Sometimes you have to use nosodes, oligotherapy, catalysts all the time, and minerals, osteopathic sonum, which I cannot function without those remedies because they are different. And if you have worked with sonums, you cannot do without the sonums because they're a main component in functional medicine. We use polysons and glandulars. We do use all these components because, remember, I have 3 other physicians that work with me. And we do use all these, not all of them together, separately. When we get to the cellular phase, you get at the higher dilutions, and you use homeopathic at high potencies, nosodes, and then we get into the cell therapy, organotherapy, glandulars, and amino acids. One of my physicians also is a biochemical engineer, so we understand biochemistry quite well. He was a biochemist and then went to medical school, and he's practiced for 30 years, so he's got a lot of experience in biochemistry. The ground regulation is extremely important. You have to have all the elements, and this, from the next few slides, are extremely important. The electrolytic component, hormonal component, and the immune component change according to the miasms of the personality. The miasms, some of them need that help, and this, which is actually the milieu, the pH. Certain personalities, you have to deal with the hormonal component. Others, you have to deal with the circulation and immune system. Very important. The objective of the treatment to normalize the matrix, you have to stimulate first the non-specific defense system, initiate drainage, general drainage. Then you have to stimulate specific defense systems according to your test, thermography, whatever you do. Then you start regenerating and detoxifying. Then you start working on the constitutional, symptomatic, and psychosomatic support, and you start regulating the autonomic nervous system. Now, if I have a choice, what I know now, the most important elements are not the sonums first if I have a patient. Minerals are number 1. Enzymes are number 2. If I have to, you force me to say, what should you use? Minerals. Why? Because I am a structure guy. Harvey, where is it? Structure, too bad I didn't put a slide on. Structure precedes function. Function precedes form. And the best way to tell your patient, ask him to bring their old shoe next appointment. You could see the wear, the pattern, and you tell them the structure created the function to run, and now the form, you have the worn down shoe. Then the form changes structure. The paradigm changes because of the form. But everything starts with structure. My son is taking biochemistry, and in his new book, it was amazing. A chapter says, structure determines information in the genetics. Everything starts with structure. And the brain is in the membrane. If you want to, any exchange happens to us or to any elements at the atomic level is the outer layer. Once you break the skin, the problem starts. When you break the cell wall, the problem starts. Same with at an atomic level. So the minerals are very important in my practice because they are the structural component. So we utilize the cell salts, and then we start getting into the sonums as we are regulating the terrain. The pH is extremely important. At the energetic component, this is what makes our office special, because as we drain, we use neural therapy. Neural therapy is just like you have the engine, but you need the spark. And once you recognize the segment that you have to drain, you do the neural therapy on that segment, and I'll make it clear for you as we go along. With the dental neural therapy, intraosseous neural therapy, whether it be segmental neural therapy, etc. The treatment phases. This is another very important slide for you and your patients. I spend a lot of time explaining to the patient the diagnostic phase, treatment phase, and stabilization phase. And this 2006 word for my practice, my kids, my wife, everybody, is awareness. Okay, could we go back one slide? Awareness. Reticular activating system. It's all awareness. We tell the patient, I don't know what's wrong with you, because they're all chronic. So the first phase of the treatment, whether it be the splint therapy, I don't know which way you do your splint work, or you start your drainage, you are in the diagnostic phase of treatment. I don't know what's wrong. You have an idea what's wrong with you. So you tell the patient, this is the diagnostic phase. So 2 months later, when they start asking you stupid questions, you tell them, by the way, we're in the diagnostic phase. I'm still diagnosing you, but we are treating you. It's not just diagnostic. You are going between these two phenomena. You're diagnosing as you treat. As one symptom goes away, you stabilize the jaw, let's say, as a dentist. Now the jaw is not locked. It moves. Now the next step, now you're going to build the mouth. Or the next step, you are ready to do cavitational surgery. You just don't do the surgery. So when the patient understands these three phases, as you educate and make the patient aware of the phases and the symptoms, and as you do detoxification yourself, and when you are in the middle of the diagnostic phase and the patient comes and they are very upset, they don't feel right because you gave them a remedy that was just too powerful, you know how to talk to them. So they understand it. The awareness between you and the patient, and you are trying to figure out the miasm of this patient all this time. You're trying to figure out what kind of a person you're dealing with. Detoxification and drainage, in my practice nowadays, maybe it will change in 5 years, I don't know, when I get some luetic in my head, is this. Constitution is who I am. Temperament, what I do. And the miasm, or the modern word is reactional mode, is what I become. When the patient comes to your office, they are at this stage. Okay? What you are trying to figure out, this is today's main lecture. You figure out their constitution, which is fairly easy, and it gets difficult. You are trying to figure out their temperament. And their reactional mode is the combination of two, and what is the latest infection they had, or what kind of medications they've been on. Is it Prozac, or is it what kind of diet? So the infections, the social behavior, and the combination of these two brings that patient in your office. And at the diagnostic phase, you're trying to figure out what kind of a patient you're dealing with. So you give him the proper liver remedy, because to drain the liver, we have many remedies, and we have learned over the years certain remedies work better at certain personalities, reactional mode. Okay? So you have to prioritize, which is a very significant component when you're dealing with chronic situation. You should know how to start, where to start. To prioritize, you have to know the individual. Why they came to your office. You have to know why they are here from Seattle or New York, or why they came here. How long they had the problem. What are they willing to do about their problem? And you are treating the past, the present, and the future. That's what you're doing. So it's individualized detoxification and drainage, which is very different than what we do in the Western world now. Everything is packaged, right? Harvey mentioned last night again that the future of medicine is back to individualized medicine. It's physical medicine. You have to put your hands on these people. You can't package anymore. Packages, you can't give them just a pill and whatever. You have to have individualized medicine. And the more you know about detoxification yourself, the more you can work with the patients. Constitution. This is the structure. Let's call it the Constitution, the structure. Now, we know Michael here, his constitution, he's strong, he's solid. If you hug him, he's muscular. That's different than a slim individual. You look at the patient and the way they react and they work with you, you start understanding how they will react during life, death, illness, sex, money, power, spirituality. Different constitutions react differently. So we have 3 types of constitutions. But this is old medicine. You could apply it to the modern world. You just have to shift a little bit. We have a carbonic, fluoric, and a phosphoric constitution. Michael, again, he is more like a carbonic character. He is concrete, strong, substantial. He likes rules, regulations. I'm sorry, you're flexible.
Go for it. Go for it.
So, but those people usually, before I go any further, our constitution also is a combination of the 3, but what mostly is the carbonic. And those people usually are very aware of how is their lawn, how other people think about their lawn or their car or their office, etc. Okay? The fluoric constitution is the guy that he's all over the place. Your cousin that, he never shows up on time, this and that, but they're very, very important how they know. Dietrich sort of is like that, but for him, appearance is not that important. It's the brains that's what's important for Dietrich. Right? So maybe he has no faith or law, but appearances. Anyhow. Now, the phosphoric people are the anal types. They're very, precise. They're very idealistic, visionary, utopian, sensitive. Their feelings are they make their decision with their feelings. And just think of a person that in your family or who works with you. Okay, those are those types. And we use constitutional remedies. We used to have only 7 constitutional remedies. Now we have whatever you want. 300 constitutional remedies. Things change. The world has changed. So we use them for acute diseases, protection, prevention, and we use them to avoid aggravation. Now we come to the temperament. What I do. All right? The choleric person, the sanguine, the melancholic, and the phlegmatic. If you remember, this is from Hippocrates. But it applies right now. And the choleric and the sanguine are the hot types. The sanguine is wet hot, choleric is dry hot. Melancholic and phlegmatic are the cold. The phlegmatic is a wet, and the melancholic is a dry. Okay? Now, the choleric, by and large, is more of a commander type. He's a team captain, CEO. When the CEO walks in your office, you know why they are a CEO and the way they look. They're usually thin. They don't gain weight. They eat a lot. They are green bile. Bile breaks down the proteins, so it breaks down. So you do not get fat. So these people, their personality traits, they make decisions very quickly. That's why they're CEOs, I guess. They're intuitive. They get angry very slowly, and they forgive very slowly. All right? And this is old music, but just think of a new current musician that is a choleric in your head. Then comes a sanguine. These are the good time Charlies. These are the types that they like to party, drink. They're usually good looking and Mr. Sanguine here. Mr. Sanguine over there. Actually, a lot of us have sanguine in them. So these are the wizards. They're enthusiastic. They argue a lot, and their personality traits. They communicate. They interact, etc. Let me interject myself. The best characteristics to have 25% of everyone. You should try to be a bit of everyone. All right? And that was Ludwig. Actually, every morning when I wake up, I'm not kidding you, I don't know why this happened to me for years, I think of Ludwig.
You kind of look like him.
You know why? You know why? Because this man was a genius, and just they don't even talk much about him anymore. You know, like, so the melancholic type, they are the sage. They have a lot of knowledge. They're team heroes, but these people get angry very quickly, and they hold a grudge. And I'm going to show you some techniques soon to make this very easy for you. Just so you don't have to go to many courses. Just look at these notes, and then I'll show you a trick. And each temperament usually has a type of a disease. Like the sanguine guys usually have a stroke or a heart attack. The choleric types end up with sclerosis. Okay? All right? These guys usually have a nervous system problem. They end up with tremors, etc., by and large. And there's Mozart for you. Now, the phlegmatic type, which is cold and wet, and also you could describe these temperaments like the phlegmatic is just like birth, the choleric is the mature. The melancholic are the types also that tell you they know everything. You cannot tell them anything anymore because they know it all. All right? So you start, as they come and they fill their forms, you start telling what temperament these people are. All right? The phlegmatic people are pretty good to deal with because they forgive quite easily. They're agreeable, and it's interesting to deal with those types. And J.S. Bach was a phlegmatic type of a person. Now we come to the real issue. When the patient presents to you, he's got the combination of his constitution and the temperament and all his social, marital, financial issues there at your office. And they present to you with 4 modes, and now you are detoxifying. Remember, this lecture is for detox and drainage, right? The psoric and the luetic people, which eventually we'll learn what they are much easy to detox. If I have to detox Mike, it's easy. I'll use anything. He will have a little reaction, and he'll be fine. But if I had to detox a tuberculinic or a psychotic, you might get into trouble. And that's what happened to me over 15, 18 years ago when certain patients got plugged right up. Like, what happened? I know one of my hygienists, we're going to do DMPS. She sees, it took over a year to get her better. Now I know what happened. And I'll show you why that happened. So the psoric reactivity mode, psychotic, tuberculinic, and luetic. The psoric are energetic people. They balance very quickly. Their autonomic nervous system goes into regulation quicker than the other reactional mode. They get irritated very quickly. They know themselves, but they overindulge in food and drink and physical pleasure. They like to party. And I know a few of you that like, and they make me party with them, And those are the types of people that in their cupboard they should have Nux Vomica at the end of the day. All right? And the psychotic person are hypoergy, they are low energy, and this second line is very important to take home. These people cannot digest the past. They will never forget, and they're so easy to find out. They sit in front of you. I always bring their husband or their partner or whatever, and I trick these people. I ask the patient, Do you remember a few incidents like 10 years ago that he didn't show up to your something? Oh yeah, 1968, he didn't show up at my party, and it was my mother's birthday, it was her 60th, and they never forget. So they cannot digest the past. These are the patients that you have to worry about them getting cancer because they cannot eliminate, they cannot digest the past. They usually calm, indifferent, and if they don't sleep well, they are not happy campers. Now, this constitution is very important to balance the minerals before you detox and drain. If you could take anything home, just give them minerals. All these constitutions, very important. Okay. The tuberculinic reaction mode, which is their element is copper, gold, silver. They are energy, weak. They are what I call them high maintenance individuals. When they have to eat, they have to eat. I mean, you have to them first, or else it's not like a historic. And they get affected, and they are very methodical. And those types, the tuberculinic types, you have to balance their hormones and electrolytes. If you do not balance the electrolytes and hormones and you give them a DMPS, you are in big trouble. And I'm just not making this up. I've seen this happen, and I've been correcting it over the years. So this constitution, you have to balance. The Luetic type, manganese, cobalt, they are disurgy. They are very energetic or no energy. You can't tell how they're going to present to you. Their lives are, by and large, not balanced, and they don't practice what they preach. The other types, they say, I'm going to go on a diet. They go on a diet, man, they lose 15 pounds, right? And 6 months later, they're back to the same patterns. Like they're always, but those are the very creative people. They're extremely creative. They're geniuses, and they have no reference, okay? And they have the right, that's their thing, to change their mind. Like, you're supposed to be here. It's important. It's a big birthday. They just don't show up. And they think it's okay. All right? The Munctaries are to detox these liver, kidney, skin, intestines, mucous membranes, lungs, and lymphatics. I don't like primary, secondary, because I don't think there's such a thing as primary or secondary. It depends what you need to do. Okay? Sinuses, stomach, etc. Now, alert. The psychotic miasm, tuberculinic miasm, do not start detoxing or draining before you balance the electrolytes, minerals, hormones, and circulation. And I'm fortunate enough, we do in our office a lot of tests with the physicians about their kidney function, their hormonal status. We do tests before. These are on chronic conditions, okay? Not everyday amalgam removal. You individualize your treatment, okay? So with the psychotic, you have to make sure the immune state and the hormonal condition and the circulation is in order, and the tuberculinic, the hormonal and nervous balance, and the electrolytic balance is important. So this is one of the main topics of today's workshop, is to make sure, know the person and how to deal with them. And the elements we use, we use a lot of oligotherapy and Schussler salts because they're very inexpensive. It's a good way to start. For the psychotic, we give manganese, copper, tuberculinic, copper, gold, silver, soric, manganese, and Luetic, manganese, copper. Before I came today, I took a manganese, copper, gold, silver because it's also anti-infective too.
Question?
Yeah.
In detoxification, getting away from the source is the first step in basic detoxification. When you're talking about detoxification here, where does the mercury amalgam removal fit into that
It's coming.
area? Okay.
It's coming. I'm preparing the patient. Remember, I said this lecture is on, I have a very large chronic pain practice. So I have to show you the general and then the individual. The amalgam is coming up next. So, but it's for me, my practice is basically referral because of many failures. So I have to establish the ground rules to know the person, and that's how I determine how I detox the patient. And I think it'll come clear to you if you hold your questions. But at the end of, I'm here all day, so I can answer your questions. It'll come clearer. All right? Just hang on for. So the stages of well-being is, again, self-awareness. You have to make the patient. First, you have to make him feel better. You just can't start detoxifying. You have to give him some palliative treatment, like with the Traumeel or Lymphomyosol, Berberis or Nux vomica or whatever. You start the palliative treatment. You start opening the emunctories globally first, general detox. And I do use a lot of UNDA numbers. The reason I use UNDA, because I know I'm very controversial. I use implants and I use metals because UNDAs have metals, and metals make a big difference in homeopathy. I think they're the tuning forks of the cells. The vibration of the metals make a difference in drainage. Okay? We start eliminating the foci like the dental or others, and very important to use the enzymes, catalysts, and cofactors. Minerals and enzymes are extremely important. Minerals, trace elements, tissue salts, gemotherapy, phytotherapy, homeopathy. Then we go into the homochords, composita, and then the big issue that we're going to get into now is dysbiosis, to answer your question about the amalgam. My biggest problem in my office till now is this dysbiosis. If you have a dysbiotic patient, it's extremely difficult to detox. And I'll tell you why in a minute. You have to support their psyche and eventually regenerate their organs. Now, I'm going to go very fast over this component because last year Louisa gave us a great lecture on the tissue salts, but I made sure I put down for you, I did a lot of work for you. In your notes, you have the drainage tissue salts. If you read my notes, okay, you have those 12 tissue salts and where you can use them for drainage. Remember, this is a drainage seminar. And they are very inexpensive. Tissue salts are basically, when you burn any animal, you have 12, the ashes left. And again, what's left when you burn down the building? Structure. Tissue salts are a big part of the structure. Structure, function, form. So structure is extremely important. And these minerals, tissue salts, help for drainage, like for example, for mucous membranes, if you want to drain mucous membranes, you could use Calcarea phosphorica. Now, for cavitation, this is a great remedy to use because it drains closed spaces. Okay? All right? And the rest of them, like we are short. How much time do I have, by the way, Michael?
3 hours.
I wish you did. I'd say that you get to go for another, 40 minutes?
Who are you asking? Felix? He doesn't know.
45 minutes, go.
45 minutes? So I have to dovetail because I have 150 slides here.
No, I know.
13, 15, 10. You got about 45 minutes.
Good.
Keep going.
So the detoxification stages are the cellular, the hepatic, the renal, the pulmonary, and then the mucous membranes. And I'll show you in a few more slides how we follow which segment we're going to treat next. Right there. As I said, kinetic patterns. I look at the patterns of the thermography, heart rate variability in dark field microscope, and I do very little electrodermal testing because you can't do everything. We do have other people do it for me. I ask one of my practitioners, like electrodermal testing, I get the remedies, and without knowing she doesn't know what I did with the patient, I say, these are 15 remedies. Check which ones work according to. I love that German statement, their articles, according to Hunuke, according to Dietrich, according to, Dino, right? So, according to thermography. So one of the tricks I use, this is for Harvey, because we've never talked about how I do my dark field. For me, I like to see the breakdown of the blood during detoxification. And it's not fair to check on the microscope when you're doing detox because the blood deteriorates much faster. So I take, if you see, there's a slide up there and 4 slides. I take 5 slides and I monitor one only. And 5 hours or 8 hours later, I'm so busy at the office, I put the next slide, okay? And I keep one slide away without putting it in the microscope till everything starts deteriorating. So I'm seeing a slide, I'm looking at a slide that was not exposed to heat because these lamps are very hot. So I take several slides and I watch the breakdown on the cells, like this, okay? And I put the time on the sheet. And let me give you an example. This is a healthy patient at the beginning. Let's say 6 hours later, about 11 hours later. This is 6 days later. What do you think of that one, Harvey? 6 days later. Is that a healthy patient?
You live 6 days on a slide, you get along. Everything got it.
Pardon?
The longer you live on the slide, the longer you live on the planet.
Yeah. Now, look at this one. This is a recovered cancer patient, okay? And this is 5 days after. Much better than this patient. The blood broke down like this before in about 2 hours, like 3 years prior. And honestly, you guys have such a huge tool, dentistry. When you remove the heavy metals and the root canals, this changes like unbelievable. And that's a cancer patient. And this is a test. What is this in the holographic picture? Yay! See? There's hope, Harvey. They're learning. That's a root canal. That's Harvey's slide. All right? So I monitor with the microscope how the red blood cells are breaking down and what's happening to this person. And as you know, whoever has a dark field, it is the most powerful aha thing for the patient. They look at that monitor and they know if they're healthy or not. You don't have to tell them. Anybody agree with me that does microscope work? The patient knows, just like they don't have to have any education. When you put that slide, they know that there's some trouble, or they just smile when they see these beautiful red blood cells floating around, okay? With patients with emotional blocks, to answer the amalgam question, there is no way we're going to do amalgam removal. And you know, sometimes you have a patient that's completely freaked out. They come to your office, they think all their illness is from their amalgam. Just slow down. Those are the patients that I do use the past year, which it's interesting, the Ruby system, we put them on, we check them for geopathic stress and put them on emotional remedies first. Okay, I'm giving you different modalities. If somebody is very nervous, upset, emotionally unstable, you're not going to do cavitation surgery on right away. But you have to sit down and explain the diagnostic phase, the treatment phase, and the stabilization phase. Okay, and you have to give them palliative treatment. First they want to feel better. You have to calm them down. Okay. So we start with the emotional remedies, and if they have a geopathic stress, it's amazing when you move their bed and you give them some geopathic remedies, how much better they get, okay? And then I usually use the minerals, oligo elements, and then we start general detox, either kidney, liver, lymph, gut, depending on what you see in your tests, kinesiology, thermography, whatever. General detox. And we go over the basic treatment guidelines with the patients. Now we're going to go over the homework the patient has to do so we can achieve drainage. Okay. We do our mechanical work, and as they are detoxing, neural therapy is so powerful. Let's say you do kidney segmental as you drain the kidney, all right? Or you do the kidney points in the mouth, and this is not at the beginning, like in the middle of the diagnostic phase. So if there is a dental site, you use intraosseous neural therapy, and for these remedies, you could use Sonum, Pasco. You could initiate global or specific drainage. Now, if the person is psoric, like you can drain them, and they have a problem, you could go there and drain them specifically, do the intraosseous neural therapy, extract the tooth, and they're fine. If that patient was tuberculinic, and you did what I just told you, you're in big trouble. You just cannot run and do that with those patients. So the whole moral of the story is you have to understand, make sure you know the patient and the patient knows what you're doing for them. So you check the thermography or whatever you did with your muscle testing, etc. You treat with segmental therapy. And if you have a thermography, you look at the third reading after you do the neural therapy, in which direction you take the patient, okay? Sometimes if you do a lot of thermography in neural therapy, their autonomic regulation gets worse. You notice? But that doesn't mean it's bad, because you really provoke the autonomic nervous system, okay? And like, for example, this one, just a quick example, you see chaos in this, and we did neural therapy, and then we have more regulation. But we really screwed up the regulation up there, even though the chest looks better, okay? So as you see, we do the segmental, and we do the third reading, all right? Or we do intraosseous neural therapy where it was a root canal, and you know how important our sinus is. We do a lot of sinus flood in our office, like a lot. And it really works. We do sinus points, flood, and everybody should take, the only wish I have, I hope Dietrich Klinghardt does not quit, because you guys all have to take the basic, I know most of you have, the basic seminars, the basic about metal detox, etc., from that guy, because you have to learn this someplace. So this is what Louisa was mentioning this morning about we have to teach this during our seminars so people don't get overwhelmed. What do you guys do? Basic neural therapy, basic flood. I mean, it doesn't take much to do this. And if you have an upper root canal tooth and you did a sinus lift and you did remove the tooth and there comes, you look at the sinus with a hole there. Okay, so repairing the terrain, creating a new biofilm using the Sonum remedies, you're creating a nice mucosal layer. It all happens with the sinus flood. And if you notice the previous slides, when we do the neural therapy, the autonomic nervous system is regulating the matrix. So you're doing Heine's work, like how the process works with neural therapy as you're cleaning the matrix. So, okay? I know I'm all over the place, but I think I'm have you in line. So you are depending on the patient when you do an extraction on the upper jaw. It's nice to have another room when they come back for suture removal to do some neural therapy and a sinus flood. It's amazing. Okay, this is very important. This is where my naturopath or my other doctor takes over because they have a lot more time. And every time they come in, they have to fill a symptom update form. And we go over the diet, the EFAs, the milieu modulators. You cannot detox properly if the milieu is not right. And I have to mention this for the mercury removal issue. I like to be controversial. Lyme's disease. Everybody, this is the new thing the last 5-6 years. They put everybody on long-term antibiotics, but I'm so dumb and methodical too, right? I'm not just sanguine. I learned years ago when you give somebody long-term antibiotics, you completely shut down the excretion of metals, completely, according to biochemists. So we do antibiotics, but I believe in pulse dosing of anything you do. I don't believe in utilizing even the same food forever. It's nice to change your food patterns. So you cannot give anything long term. It just doesn't work with the system. So probiotics are extremely important. The castor oil packs, we go over their movement, hydrotherapy, sleep hygiene. We make sure. One of the questions I ask the patient is, what do you like to do? And they're usually simple things. And in their homework, they have to take 3 times a week, go for a walk, whatever they like to do. So this is a part of them. The emotional hygiene is extremely important. Be aware. We use this word a lot down in our office. And take notes, all right? This is another big pearl, and because of this is the pain practice, the patient, every time they come in, they fill a form, and this is going to be really fun for you. And it's very easy to fill. It takes anywhere between 2 minutes to half an hour, depending on the miasm of the patient. I'll show you why. So we ask them basic questions: the pain, the range of motion, sleep, very important, energy, appetite, mood, menstrual cycle. Have you had any headaches, illness, emotional trauma, or unusual stress since your last visit? Have you had any problems doing this, the stretches, castor oil packs? We ask them that. They sit in the room, you ask them, are you doing this right? What is causing the most discomfort today? Now, the next 4 slides are real fun for me anyway. Now, this is a symptom update, and on the other side, we have the skeleton. They have to draw pictures, right? And this is one of the biggest detector for me, those forms. After you have 10 forms, you know exactly the personality, what you're dealing with. A Lytic person, they tend to change a lot, and they don't fill too much, all right? And then the next, and they know, we tell them, could you please the other side too? And they just put like here, that's the next appointment. These are 2 different appointments. I made sure I gave you 2 appointments. And they never mentioned it, even though, just put a little X here. But this one, this is a tuberculinic patient. And dare you not pay attention to every word they wrote. They write everything. And it's very neat. Okay? And look how neatly they put they scratch properly, all the tension points. When you have a patient filling forms like this time after time, bring out the, copper, gold, silver. Like this is really cool. It works. I mean, that's easy. So you start formulating what you're dealing with here, right? Now, this guy is a psoric guy. Just fix me. I want to go to my trip, right? Neck. We forced him to fill this, all right? And the other side, nothing, and we had to make him, please scratch some. Neck, okay, there. Just fix my neck. Well, the neck pain is something. Then this one, wow, this is a psychotic patient. Diastasis too. They cannot digest the past. And they ask me, did you read everything? Ara, did you read? And they, point by point, they write down what they want. And they put the stars. I mean, the pattern is very similar. And on the other side, they fill differently than the tuberculinics. The tuberculinics usually make sure they put exactly the elements and they draw it right. These guys just say, make sure, that's very typical of those. So, manganese, copper. Manganese for us. All right. So, now, this is a very, very big topic. This is to answer your question, sir, regarding heavy metals and mercury. And please take Dietrich Klinghardt courses. And this is a huge topic. Heavy metal as a potential root cause of chronic illness. And we had several great speakers. I'll just add a few things that they did not mention because of the time constraint. Now, after we start the general detox on chronic patients, we're talking about pain patients, okay, not your everyday amalgam patient. We start, the patient know the treatment guidelines, etc. Then we start removing the heavy metals because they're neurotoxic, nephrotoxic, and they create cardiovascular disease. And we have many papers written that somehow heavy metals have affinity to cardiac muscle over 10 times more than skeletal muscle. They accumulate there. And you know the biochemistry of that. And heavy metals deplete selenium, and when you have no selenium, you can't convert T4 to T3. You have all these thyroid problems. You have the drainage problem coming right to the thyroid. So heavy metals reduce the resistance to bacteria, protozoa, fungi. They compromise the gastrointestinal integrity. Now, that is the biggest, heaviest issue in my practice, fixing the gut. The gut is so important. So when we have a dysbiotic patient, that is, to me, if you have any tips, I'm very open to learn more. They're very difficult to detox. Even when you give them the sulfhydryl groups, it doesn't work with these people. They react badly. So these are the groups that you have to do IV work, and you have to really maintain them. Like these are the dysbiotic types. We do more IVC and try to get their gut better because, and the other element we don't talk about is lead. We talk a lot about this mercury toxicity, but lead toxicity is just as bad, if not more, in my office. Well, once we started doing the other modalities, because lead really works on the cellular level and especially on the arterial level, because we only have one thickness of one cell in the arterioles, and once a lead binds to that, you are right down to the intima. So lead toxicity is just as important to deal with in chronic pain patients. Now, osteoporosis, when the estrogen levels are reduced, the bone starts, and all lead is stored in bone. Now we have perimenopausal women, you have such high level of lead because of the estrogen problem we have. So, and if you have that patient, and that patient is tuberculinic, the constitution, and they have a lot of lead, so you have to be very careful taking the lead out and removing the heavy metals. So, candida, when you have high valence candida, they manufacture inorganic and organic chemistry into mercury into methyl mercury. So they are constantly producing methyl mercury, and we can't excrete it. They're excreting it. They're big manufacturers. Okay, of heavy metals. So in dealing with dysbiosis is very, very difficult. And those are the patients that you should hurry up and remove the heavy metals. All right? So when we treat them, we break down and displace the pathogen, and we try to restore the normal flora, and we just start changing the milieu. And we use a lot of Sonum remedies and probiotics, etc. in our office. Okay? Now, the new probiotic formulas, they call them synbiotics, as some of you know. They are these prebiotics which are coated with this non-digestible dietary fiber as inulin, and they claim that the bugs are alive, because in Vancouver they did a test in one of our hospitals. They went to health food stores, and people like us were very ashamed. They tested about 30 probiotics. They're all dead. So they started laughing at our community, like, you give them this, and look, except one or two products were good. So it's very important for our group to find the proper product line.
Pharmax is good. We tested a bunch of stuff this past week, and Pharmax is
Yeah, that's one of the ones that tested good, actually. I'm not kidding. It was published, and only
Primal
two...
Defense is dead. 0.01% of life in Primal Defense, and it's one of the biggest marketed probiotics.
And it was what?
Primal defense.
Yeah.
Dead. Primal Defense
Yeah.
is one of the biggest marketed, and now they're marketing it to practitioners, and it's dead, completely dead.
Yeah.
And they say the theory is that they come to life in your body, and I said that would be a little hard to do after being in a capsule and plastic.
Okay. So to restore the GI, mineral again, start general detox, utilizing the HEAL system, the Sonum system, the UNDA system, botanical, or the Klinghardt system, which is wonderful. We use IV glutathione bolus, then we remove the source. The toxicologists always talk about remove the source. Okay, but in these, when you're dealing with a human being, you have to recognize the human being. If you can remove, then you start removing the heavy metals. All right? So the duration of the detox depends on, again, on these patients' personalities. A psoric and a leuetic patient really detox very fast. The patient who are reaction mode 2, the psychotic, they detox much slower. They hang on to the past. Their gut, they have usually a lot of constipation, etc. So you have to really make that gut moving. All right? Then after we do the general detox and we get all the emunctories working well, then we get into the DMPS, DMSA challenge, and that's where my physician takes over. And I just gave you the formulation, and we forgot the DMPS is 10 milligram per kilogram. So this is the protocol we follow now. It might change in 2 years, but this is the protocol, and you have it in your handouts. And we make sure we hydrate the patient, and we make it quite easy. But mostly we use IV method, and I put that over here so you could. We make sure we replenish the minerals, especially zinc, copper, manganese. All right. So probiotic formulas, we treat the milieu. We use Pliocitro or others. Plio-X is very popular in our office. Then we start working on the wet tissue like Ricarcine. We use the bacterial remedies. Then if it's huge cavitations, we start using Plio-Art A to restore the bone, okay? And we use for the gut Plio-Oku or other botanicals. And as Bruce mentioned, we use mucosa compositum from Heal quite a bit. And Fortokil, we use Fort a lot. Okay, well, it's in the sonum up there, okay? Pleofort is an amazing remedy, amazing. Yeah, but you have to prepare for the Pleofort. It's preparing the patient is very important. This is one slide for the haptenic therapy, which we do use, and the polysaccharides, as I loved the lecture yesterday, is such a good speaker. The polysaccharides, we have to bind the partial parts of the cell wall that's broken down, which we cannot excrete, because that polysaccharide could create a problem in our communication system at the cellular level. And it disrupts our autonomic nervous system, and we have continuous dysregulation. So haptenic therapy, if a patient comes and they've used antibiotics for a long time, I bet you anything they're going to have haptenic therapy in our office. It's one of the protocols that we get to afterwards, not at the beginning. So it's a huge topic, and this is one of my little projects now, using haptenic therapy, and I'm learning. And the cell wall deficient microbes they are big now, they're going to be even bigger. All right? So we use haptenic therapy. We use it with segmental therapy. We give them drops. Okay? Now, this is the dental talk. I have lectured here 3 times, and one of them was the intraosseous neural therapy, and I hope you guys are using it. I know Michael is using it, and if you really use it, it works. You save hundreds of root canal teeth. Do you agree?
Oh, 100%.
I mean, it's such a neat technique, and the invasiveness is so little, and you could do a lot of tricks. And if you combine it with some other intraoral acupuncture points, it's fabulous. So I still use the old technique of Stabident, and I use 100% Procaine. We use the homotoxicological remedies, sonum remedies, and I use DMSO now, and others. So this is a technique. Basically, I don't want to bore the dentists that did it for the last 10 years. And the other thing is, you watch that blood come out, huh, Michael? If it comes out stasis and red and dark like that, and you put lymphomyosote there and Traumeel, and you do it 2-3 times, that blood turns into pink and it flows. It's a great physical diagnostic test. It's so easy. Just look how the blood is coming out, all right? Now, this is a patient who was an engineer, could not function, couldn't work. Actually, that was Veronica's patient. So we did some remove this root canal tooth, etc. And it's very difficult to remove this tattoo. Okay? This is after. We used many remedies, and in time you get rid. We used DMPS. We used DMSO. Eventually, we used all the sonums. I mean, you name it, we use it in sequence slowly. Oh, he still comes because it gives him an amazing boost. We also do it palatally, which is another trick, you guys. For the posterior upper molars, I think, teach me if you have any new tricks, I think this is a great technique. The palatal approach is easier, much easier, and you spread the remedies much faster with the palatal approach. That was before, after. Okay, the diagnostic techniques, you could use applied kinesiology, electrodermal testing, radiograph, cavitat, bone scan, regulation thermography. So as we do the neural therapy in that segment, let's say the kidney is involved and the tooth which is involved with the kidney, as I showed you earlier, we do segmental neural therapy on the patient. I do it, and if you want to do it, hire a physician in your office or get someone to do it. And I think dental medicine, this group eventually should evolve into a political level that we legally could do all these procedures. So intraosseous neural therapy, ganglion injections, segmental therapy, and actually I also use the Gleditch points. I have a chart in my office. You could use the neural therapy and you could do the Gleditch points. If you guys remember, he gave us a great lecture here about 10 years ago or so. And again, sinus flood. Now, the remedies we use, again, when we do an interosseous neural therapy, if it's a hot tooth, we use Traumeel, Lymphdiarol, etc. But if it's a liver problem and it's a cuspid, we use Nux vomica or Hepar or Hepil, and we do the segmental therapy. If it's a kidney problem, we use Berberis or Solidago. If it's a matrix problem, we use Lymphdiarol, Gallium, Thyroidea. If it's a cellular problem, we go into the ubiquinone coenzyme composite glyoxal. Like Bruce also showed exactly the same remedies because you just follow the formula of HEAL. And I've used a lot of HEAL injectables. So we inject the appropriate tooth site, and you could use the Gleditch points at the same time, and you do segmental therapy. So you can imagine how fast you are mobilizing this patient. Because the emunctories are already moving, you are challenging the body now. All right? So to treat the alveolar mucosa, we use lymphomycin, Traumeel. Aesculus, circulation is extremely important. We use sonum remedies to rebuild the bone. Pleonig is for building the bone. For circulation, Pleomuc. If you have an infection, Pleonot, Art-A, PEF, DMSO, and DMPS. We mix them with Procaine. Trigeminal neuralgia, which we talked about yesterday, again, is basically the bone marrow defect. We're going to skip over these. Basically, it's a circulation problem as far as I'm concerned. So we have osteonecrosis. We're going to skip over these slides because they're very, very similar to what Michael showed yesterday, because I've taken courses from Jerry Boku, and a lot of these are, from his slides, or these are, I want to skip because I only have 10 minutes, right?
Right.
All right. So we diagnose, this is again the neuralgia, what Michael went over yesterday. Basically, when we're doing the neural therapy, we're dealing with this submandibular ganglion or the sphenopalatine ganglion. And this is how they look, the neuralgia patients. They're so fungal. They have this. One thing I know about neuralgia patients, they have dysbiosis. They're dysbiotic. You have to fix the dysbiosis or you cannot get rid of any neuralgia. So sphenopalatine, submandibular, all this junk coming out. Who says there's no cavitation? Look at that. What's that sludge? And then we clean that. And afterwards, we do the interosseous neural therapy. After they heal, we start adding the remedies. All right? Then we support with rinsing the area. Also, when I clean the site, I use Sonum remedies all the time. I use Sonums when I rinse, and I give them Sonums. Sonums are very, very important. Then we use orthomolecular medicine, the calcium EDTA, the amino acids, cod liver oil. So we are covering what with the fatty acids, etc. So we are reducing the load if they have viral problems, etc. Okay? Then these are the remedies we use with the neuralgias. Leptospermicin is amazing with certain cases. Dulcamera and rhododendron in neuralgia patient, if they are sensitive to the weather, they are a must to use. I use rhododendron and dulcamera intraosseously, and I give them drops, and patients swear by it. And it's very easy. You ask them, does your problem start, can you tell the weather is changing? Oh yeah, how did you know? Well, those are the patients that immediately start using rhododendron or dulcamera. You test them and you use that. Okay, they really react well with that. And for pre-surgical treatment, one of the remedies we use a lot is calcarea sulfurica and the Schussler salts. It's very inexpensive, works on the closed spaces, and these are nice notes for what undas we use for circulation, for neuralgia, and we try to improve the circulation by using these here remedies, okay? So we are trying to encourage circulation. Okay. As we do these treatments, I retest them, and I don't charge my patients for the thermography because it's very important to follow the kinetic pattern. I am watching now the patient, where we're taking the patient. Is the segment changing? Is his kidneys are looking better? Because it's a kidney. And if you know physical medicine and other types of medicine, you know the kidneys and feet, sore feet, hot feet. I can't walk. Usually it's kidney, plugged up with heavy metals. So you have to be very careful. And also when you're doing DMPS, make sure you use Alcala or make sure their pH is right. Because if you're doing DMPS, well, it's well known that the DMPS releases the cadmium in the kidney unless you have proper pH. This is a very important point. The pH has to be important when you do DMPS IV, or else you're dumping the cadmium in the kidneys. All right? IV, but make sure you use make sure their pH is right. Like Alcala is one of them. Okay? All right. You prioritize a segment. And you do the treatments according to the segment. Like sinus goes with the prostate, kidney, and joint pain, liver, gallbladder, etc. Okay. Do not forget the teeth, tonsils. All right. The goal is drainage therapy, regulation therapy, organ support therapy, organ regeneration. Now we get into the regeneration. We start using cell therapy, etc. And that's what Harvey and I talk a lot about, cell therapy, because that's the future of medicine. And the goal is to have a healthy, happy, emotionally stable patient. Now we come to the stabilization phase. Our patients, we have recalls, like in dentistry. They come back. We go over their structural support, physiologic support, and psychological support. So we maintain them with remedies because we have the physicians working with us. So this is a very cool slide for me anyways. So the goal is to go towards fermentation. All the slides we saw all this weekend, the patient is going towards putrefaction. So what we have to do is go towards fermentation. That's the goal. Now, the take-home messages, today's workshop was make sure you are aware with the personality, the miasm. If you make sure you regulate these two types, or else you get into trouble when you're doing the detox drainage. Assess the gut. Make sure you assess the kidney function before you do any heavy-duty DMPS and DMSA, or else you're going to get in real trouble. Kidney function. All right? And then make sure the patient is aware of his condition and the crisis he or she could experience during the detoxification and drainage. All right? That's it.
That was
That was wonderful.
Thank you very much. That was fascinating. If you'll all go on into the exhibit hall, thank our exhibitors for being here. That was wonderful. I'm telling you. And then we're going to start in about 45 minutes. Okay, 30 minutes, but I know you guys. You're on Jewish Standard Time. You'll make it 45.